Are you aware that colon cancer is the fourth leading cause of cancer-related deaths in the United States? Prepare yourself for a sobering reality check, my friends. We're about to delve into a topic that demands our utmost attention. Picture this: colon cancer, the silent enemy lurking within our society. It's a formidable foe, responsible for a staggering number of cancer-related deaths in the United States. Brace yourself for the shocking truth. More than 100,000 new cases of colon cancer are diagnosed each year. That's like a small town being blindsided by this insidious disease. But here's the kicker. Most cases go unnoticed until it's too late, making early detection a matter of life and death. Today, we embark on a mission to shed light on the top 10 early warning signs of colon cancer. The signs that, if recognized in time, could potentially save lives. So, my fellow warriors, let's arm ourselves with knowledge and face this adversary head-on. Get ready to learn, reflect, and act, because when it comes to colon cancer, ignorance is not an option. Are you up for the challenge? Let's confront this formidable foe together, one warning sign at a time. Recognizing the 10 silent signs of colon cancer. Number 1. Rectal bleeding. Rectal bleeding is a significant warning sign that should never be overlooked. If you notice blood in your stool or experience bleeding from the rectum, it's essential to take it seriously and seek medical attention promptly. The color of the blood can provide valuable information about the potential location of the bleeding within the gastrointestinal tract. Bright red blood in the stool typically indicates bleeding in the lower intestinal tract or rectum. This could be caused by various factors, including hemorrhoids, anal fissures, or inflammation in the lower digestive system. On the other hand, if the blood appears dark-colored or maroon, it may suggest bleeding higher up in the gastrointestinal tract, such as the stomach or small intestine. This can be a more concerning indication and may be associated with conditions like ulcers, diverticulosis, or even colon cancer. Number 2. Unexplained weight loss. Unexplained weight loss can be a concerning symptom that warrants evaluation by a healthcare professional. If you experience sudden and significant weight loss without any intentional changes in your diet or physical activity, it is essential to take notice. Weight loss is typically considered unexplained when it occurs unintentionally and without an apparent reason. It may be a result of various underlying health conditions, including cancer, including colon cancer. In the context of colon cancer, unexplained weight loss can occur due to several factors. The presence of a tumor in the colon can interfere with the normal absorption of nutrients, leading to weight loss. Additionally, cancer cells can release substances that alter the body's metabolism, causing a decrease in appetite and subsequent weight loss. Number 3. Iron deficiency anemia. Iron deficiency anemia is a condition characterized by a lack of healthy red blood cells or hemoglobin, which are responsible for carrying oxygen to the body's tissues. In the context of colon cancer, anemia is closely linked to the disease and can serve as a potential indicator of its presence. One of the reasons anemia is associated with colon cancer is the occurrence of intestinal bleeding. Interestingly, this bleeding can happen without noticeable signs of rectal bleeding or blood in the stool. Instead, blood loss occurs internally within the gastrointestinal tract, often due to the presence of tumors or lesions in the colon. This hidden bleeding gradually leads to a decrease in red blood cell count and hemoglobin levels, eventually resulting in anemia. The symptoms of anemia caused by colon cancer can be quite debilitating. Fatigue, shortness of breath, and lightheadedness are common manifestations that can significantly impact a person's daily life and overall well-being. As the body becomes deprived of sufficient oxygen due to the reduced red blood cell count, these symptoms may become more pronounced. Number 4. Pelvic pain. Pelvic pain is an important symptom to be aware of, although it is not considered an early warning sign of colon cancer itself. While pelvic pain may not directly indicate the presence of colon cancer, it can potentially signify the spread of cancerous cells from the intestines to the pelvic region. For individuals who have a history of intestinal issues, such as colon polyps or inflammatory bowel disease, being mindful of pelvic pain becomes even more significant. The presence of these conditions can increase the risk of developing colon cancer and may warrant closer attention to any abdominal or pelvic discomfort experienced. Number 5. Incomplete bowel movement. The sensation of incomplete bowel movements, where you consistently feel like you haven't fully emptied your bowels after a bowel movement, can be a cause for concern and should not be ignored. Normally, after a bowel movement, you should feel a sense of relief and emptiness in your bowels. However, if you frequently experience the feeling that something is left behind or that your bowel movements are incomplete, it may indicate an underlying issue. Several factors can contribute to a feeling of incomplete bowel movements. These can include constipation, where stools are hard and difficult to pass, or a blockage in the colon that hinders the complete evacuation of waste. Other potential causes may include muscle dysfunction in the pelvic floor, which can affect the coordination of bowel movements, or the presence of polyps or tumors in the colon that obstruct the passage of stool. Number 6. Narrow stools. Narrow stools, or a change in the shape and size of your stool where they become thinner than usual, can be a potential warning sign that should not be ignored. Under normal circumstances, the diameter of your stool is determined by the width of your colon. However, if you notice a persistent change in the width of your stools, particularly if they become consistently narrower than before, it may indicate an underlying issue that requires further investigation. Narrowing of the stool can occur due to several reasons. One possible cause is a partial obstruction in the colon or rectum. This obstruction could be caused by various factors such as a tumor, polyps, inflammation, or scarring. As the stool passes through a narrowed section of the intestine, it may result in a change in its shape and size. 7. Nausea and vomiting. Nausea and vomiting are symptoms that can occur in various health conditions, including colon cancer. They can be persistent and may warrant medical attention, especially if accompanied by other concerning symptoms. In the context of colon cancer, these symptoms can be attributed to several factors. Firstly, cancer cells can release substances that interfere with the normal processing of food by the body. This disruption can lead to persistent nausea and vomiting as the digestive system struggles to properly break down and absorb nutrients. Additionally, in some cases of colon cancer, a tumor may develop in the rectum. As the tumor grows, it can obstruct the intestines, causing a buildup of waste and toxins in the body. This obstruction further contributes to digestive disturbances, including nausea and vomiting. Number 8. Abdominal pain. Abdominal pain and chronic fatigue are symptoms that can be associated with colon cancer, although they can also be indicative of various other conditions. Understanding the possible connections and seeking medical evaluation is essential for proper diagnosis and management. In the case of colon cancer, abdominal pain can arise when cancerous tumors grow within the colon. As these tumors increase in size, they can obstruct the intestines, leading to a range of discomforting symptoms. This obstruction can cause pain, cramps, bloating, and distension in the abdominal area. The severity of the pain can vary from mild to severe and may be accompanied by other digestive issues. Chronic fatigue, on the other hand, is a common symptom experienced by individuals with various types of cancer, including colon cancer. Several factors contribute to fatigue in cancer patients. Firstly, the presence of cancerous cells in the body can lead to metabolic changes, affecting energy levels. Additionally, colon cancer can cause malnutrition and weight loss, which further contributes to fatigue. Furthermore, if individuals are undergoing chemotherapy as part of their cancer treatment, the treatment itself can cause fatigue as a side effect. Number 9. Loss of appetite. Loss of appetite and diarrhea are two symptoms that can be associated with colon cancer, albeit they can also occur due to other conditions. Understanding their potential connection to colon cancer can help in recognizing warning signs and seeking appropriate medical attention. Cancer cells can release substances that interfere with the body's normal food processing mechanisms. These substances can disrupt the appetite-regulating signals and alter the way the body perceives hunger and satiety. As a result, individuals with colon cancer may experience a significant loss of appetite, leading to reduced dietary intake. This loss of appetite can occur during both the early and advanced stages of the disease. Diarrhea is characterized by loose, watery stools occurring more than 3 times a day. While it can be caused by various factors such as infections or dietary changes, persistent diarrhea should be evaluated, especially if accompanied by other concerning symptoms. In the case of colon cancer, diarrhea can be a result of the tumor affecting the normal absorption of water and nutrients in the colon. Number 10.
Family history.
Family history plays a crucial role in assessing an individual's risk for colon cancer. If you have close relatives, such as parents, siblings, or children, who have been diagnosed with colon cancer or other related conditions, it can increase your own risk of developing the disease. The reason for this increased risk is often attributed to a combination of genetic and environmental factors. In some cases, there may be inherited gene mutations or genetic syndromes within the family that predispose individuals to a higher risk of colon cancer. Examples of such syndromes include familial adenomatous polyposis, FAP, and Lynch syndrome, hereditary non-polyposis colorectal cancer or HNPCC. In conclusion, recognizing the early warning signs of colon cancer is crucial for early detection and timely intervention. If you or someone you know is experiencing these symptoms, it's essential to consult a healthcare professional for proper evaluation and guidance. Remember, early detection can significantly increase the chances of successful treatment and improved outcomes. If you find this video informative and helpful, we encourage you to like and subscribe to our channel. By doing so, you'll stay updated with valuable content focused on health education and awareness. Your support is invaluable in helping us reach more people and potentially save lives through increased awareness. Thank you for watching, and don't forget to hit that like button and subscribe. Stay well and be proactive in your health journey.